So if we can just call the meeting to order, it's 7:34 p.m. Board of Health. Apologize, I'm not ignoring people. I'm just looking at another screen for the agenda.
And so, Henry, I'll ask that the minutes, if we could table the minutes till next month. I did not get a chance to review them. I did look through them, and I do have several corrections I want to make in terms of sort of substantial content corrections. So if we could table those till next month, that'd be appreciated.
Great. And I think you had mentioned, you had sent an email to me saying that we couldn't vote on it today anyway because the meeting hadn't been posted in time?
Yeah, so there was by the time we sent it to the town clerk, they advised us that they couldn't post it, and so it's essentially an informational meeting tonight. We don't have any critical items on the agenda other than the minutes, and even then I didn't get a chance to review them just because we were running kind of crazy at the end of the week last week to get everything done.
Sure, great. Sans, do we need a motion to do that, or
no,
the approval of the meeting minutes?
I believe since it's just an informational meeting that we can just proceed.
Okay, fantastic. All right, so we'll move to our Director of Health report.
Sure. So I wanted to share that, sort of a status of where we are with COVID. I gave this presentation today at the Board of Selectmen meeting. I was asked to present there. And so my apologies if anybody listened to that. It'll be somewhat of a repeat on portion of that. So essentially, the key message that we've been trying to get across to leadership of the town and to the public is that we are currently in wave 2 of the pandemic that started in the state in early August, and then in Fairfield, it's from what we can tell, looked like it started in early September. So it was a little delayed from August. We were kind of holding level in August, and now we're starting to see how this is different. This wave, see the impact of it is essentially that it's schools are open, at least in hybrid, and businesses are open for the most part. There's sports activity going on. So all these additional variables come into play in how severe this wave of the pandemic is. We are hoping that the mitigation measures that we're putting in place will, as we talked about last time, flatten the curve. Hopefully that we won't be taxing healthcare resources significantly in this wave. But it is here, it's starting. The State Department of Public Health has said, yes, we're in the second wave, and to act accordingly. So where we are now in Fairfield, we went over 1,000 cases just this past week, 1,015 cases, about 700 of which have recovered. About 51% of those cases are in the general population. 28% are in elder care facilities, and 21% are university students. So with Fairfield University, they just updated their website tonight. I think I'm trying to see if I printed that out. Maybe I can grab it off the printer. But they have tested now. I didn't grab it off the printer. They've tested over 7,000 plus tests on students and staff, and they've come up with 283 positives. And that may be off a few. Just their number today was updated a little bit, but they're at about 280 plus cases out of 7,000 tests. About 130 of those have recovered, and so they've got 158 active cases going on right now. And so they're doing a combination of things. With they have a isolation facility on campus that they isolate. They quarantine in a hotel in Bridgeport, the Holiday Inn, and then that's for on-campus students. And then for off-campus students, they're having them isolate in their dwellings, just like Fairfield residents would. At Sacred Heart, they've done about 6,100 tests, and they've had a total of 304 cases. They have about 62 active right now on campus. And so, Sacred Heart kind of had a little bit of an outbreak situation earlier in the school year, mostly in their off-campus and then some on campus. And Fairfield U, as many of you may have heard, the week before last, started seeing some significant increases. We're still waiting to get all the final numbers. It seems to have sort of leveled and decreased a little bit this week, and we're hoping to see some additional decreases as the mitigation steps that they've implemented have time to take effect. So both universities have experienced some peaks in activity, just like Fairfield Ludlow High School experienced a peak in activity a few weeks back, and they put in significant measures to mitigate that. And I'll talk more about that a little later. We're seeing our test availability dramatically increase in town in terms of there's several facilities where it's available. It's easy to get an appointment relatively quickly, and the results, we're not seeing the delays in results that we have been seeing over the past few months of 10 days, 12 days in getting PCR tests back. And so that's a good sign. And a couple large institutes and practices have kind of come together where they're combining to do large numbers of testing at the universities, 600-700 a day. And so that's coming out, and as well as Yale's Saliva Direct test is starting to be utilized at our university. So that's providing sort of an easier collection methodology, and the Binax Now tests are starting to ship. Our Abbott product that's starting to ship from the federal government. The state is getting them out now. I know Fairfield U received almost 400 of them. They are still waiting for the methodology in terms of how they plan to use them is coming from the state. The state just released that. And so sort of how they just wish those tests to be used. They are a antigen test, not a PCR test. So what we're seeing now as the largest instance of transmission from our contact tracing is really what we're seeing is cases in small gatherings, smaller types of events or parties or just gatherings at houses where people feel more comfortable and are taking off their masks, and they're not maintaining social distance, seems to be the most common method of transmission. Up until the last week or so, it had been pretty clear on transmission pathways. Most everybody said during the contact tracing interviews, yes, I got it from my son who came home from college, I got it from my husband who got it from work, and I got it from and clear transmission pathways, clusters, all kind of associated, both in the Fairfield University cases initially and in town cases, and in the Fairfield Ludlow cases. That's what we are seeing. And so that's been kind of our main message we're trying to get out is about wearing masks and, and making sure that you're, even if you're getting together with others that are outside of your household, small gatherings, you should still wear a mask, still practice social distancing as much as possible. So we're trying to push that message out. The emergency management team's public information group put together a video that featured Ward, Ludlow, Sacred Heart, and Fairfield U students. I think many of you probably saw that. It's a great video. So that's part of the messaging campaign that we're working on to adjust to the current findings. So about in the last week, what we've seen, week and a half, is a few more cases where individuals are not entirely sure exactly where they got it from. And so it's some inkling of community-based transmission starting to occur. So this is somewhat expected that would occur. And so we are essentially trying to up our messaging related to that as well, in terms of, that to limit your contacts outside of your household, but also taking those just basic preventative steps that everybody should be taking in terms of washing your hands, wearing masks, not touching your face, your nose, your mouth, that kind of thing. And so that the messaging will transition to or supplement what the current messaging is as we move into more community-based transmission potentially. Just to address that, we have brought on, we had a part-time individual that we've made full-time to work on contact tracing, and we just hired a second part-time contact tracer, and our contact tracing staff, our leadership of the contact tracing team is actually interviewing 4 additional contact tracers tomorrow. So we will hopefully have a pool of people to pull from that we can. What we're finding, we were able to handle it throughout most of the summer. It was going along fine, and then once we got to the Fairfield Ludlow case, we saw sort of the significant impact of that event on our contact tracing staff. I mean, it was a team effort in terms of our contact tracers and Jill and myself and the headmaster of Fairfield Ludlow and Mike and Andrea Clark and a whole bunch of people were a part of that effort to, essentially we were able to very quickly identify all the cases, identify all the contacts. Within about 5 hours, we had everyone that we were aware of identified, isolated, all the contacts notified, aware of their need to quarantine, and then later in the evening, around 8, we had a conference call with Mike and the leadership of the Fairfield Public Schools to talk about the implications of it, to ensure that we're doing all, that we had done all we can do, and that the decision was made to just to close the school for a couple of days to allow for additional. What happens in these situations, as many of you know, is people hear about it and then they go out and get themselves tested, and so you have additional cases pop up, additional contacts, and so it really did work. The system that we had put in place that we had discussed of closing for a few days to allow for contact tracing and the additional testing worked out well. We did reopen the following Tuesday, but then we did see some additional cases happen again at Ludlow High School, and so it was part of the same. It was actually a different cluster of kids at that point, but related to similar activity. Really was small gatherings outside the school setting where these individuals were getting together. But it was our first sort of test of responding to a COVID outbreak in a school setting. We had experienced something similar back in the early summer with a series of parties that happened, and we had a cluster of cases then. But this was a good joint effort to quickly address the issue and put in place control measures to mitigate it. The Fairfield Ludlow cases have really trailed off, and through our contact tracing, we didn't really see anything that led to a strong indication of transmission happening in classes, in other areas of the school, even really amongst the sports. There were some sports players, sports team participants involved, but we didn't see any clear indication of transmission occurring there. It could more easily be explained by exposure to other people that were positive. So then as that was trailing off, we started seeing the increase in the Fairfield U cases that I discussed earlier. with the Fairfield though, as well as the Fairfield U cases, and as we had done with Sacred Heart earlier in the year, we had some conference calls with leadership of the school and our team and Department of Public Health to ensure that all the mitigation measures that we're putting in place were appropriate, and if the state felt we should apply additional mitigation measures. And so we did meet in regards to the Fairfield University situation. The numbers started increasing. We saw a couple days of, they were seeing 3 to 4 cases a day, and then it jumped up to seeing 10 and then 20, and then one day it peaked at 30 cases in one day. And so we immediately met with the leadership of the university, one of the vice presidents, or 2 of the vice presidents, Julia Duffy from the health center, Susan Burge, who's the health and social services, I think, coordinator. But she's above the health center, oversees the health center activity, and so we met with them, and had quite a long conference. Had 2 of them over 2 days. Thursday we had sort of made several significant demands of the university to take substantial measures to curb the activity that was happening. They were heading into a leadership meeting of the university. We had another call with them the next day, and they had essentially agreed and went beyond what we had asked for in terms of the actions. So, as some of you may have heard, they quarantined or locked down, if you will, an entire dorm. The cases and they had a series of cases in this particular dorm. It was really kind of focused around 3 areas of one particular dorm, some sports teams, and the beach area students. They locked down the dorm. They had already pulled out the cases and put them in isolation, and pulled out the contacts and put them in quarantine, but essentially locked down the rest of the students so they were not going to classes. They were not interacting with other students. They were they had meal delivery to the dorm. They were allowed to go outside of the grounds around the dorm, but were not allowed to interact with the campus population. And then in addition, they focused testing on those dorm students, several times since then to try and capture all the cases that were occurring there. So those students are still on lockdown. And then in addition, they canceled all sports activities. They closed their sports facilities for training and working out, closed gyms and fitness centers. They required that all the students in the beach area go to remote learning, and asked them or directed them to stay in their homes or on their properties and not to interact with other students. In addition, they arranged for testing to occur down in the beach area, so they actually came and rented Jackie Durrell Pavilion and had Griffin Hospital come and do some 380 some odd tests last Wednesday, and then they're doing it again this week down in the beach area to test retest students in the area. They've increased their testing on campus, and are doing, bringing in additional testing services. And they've changed as of today, they just changed their dashboard to reflect some of the requests of the community in terms of differentiating the different populations that are impacted, as well as showing some trend data that we requested. So that new dashboard was posted today. And so that is, some of the work going on with Fairfield University. We had a second meeting with them this past week, actually a third conference with them this past week. We'll have an additional one this week. We are starting to see the cases somewhat level out and then slight decline. So we're hopeful to see the data, the daily data coming in. Today, I think, there was only diagnostic testing going on today, and they had 8 people with illness, coming into their center. So we continue to, on nearly a daily basis, or I would say multiple times a day, working with Fairfield Public Schools and leadership there, participating. Jill will share later, participating in a reopening committee today with Christine and Henry. I don't know if you were in that one too, but we continue to interact, speaking most every day, most every weekend day, and responding to questions and requests and reviews, and responding to the numerous emails that we get that come, where Mike will say, well, this section of it should be answered by the health department. So either Jill or myself will compose that section of a reply. So it's been a very good collaborative effort, So moving on from the contact tracing and the cases that we're seeing to max vaccination planning.
Actually, sorry, Sans, I apologize for interrupting. I appreciate all that information, and it's a lot of information. I just had a couple questions in terms of contact tracing. And if anyone else had any questions, I thought that was just a good stopping point.
Okay.
Or a break. Just out of curiosity, do you seem to be getting, and maybe Jill could chime in, as far as the contact tracing, do you seem to be getting the cooperation or more cooperation from students and the public? I know that was always a concern in terms of, getting cooperation so that we could get out there and get the right information. Any sense of whether that's going well, not so well? Do we need to do better messaging?
So I'll start and let Jill follow up. We do get some people that just simply say, I don't want to tell you who my contacts are. I notified them all. They know what to do. So we are still getting that. We had several instances throughout these different scenarios that I've mentioned where people just weren't straightforward with us, and through other contacts and through other interviews, realizing that, these people simply aren't telling us the truth, that people who are symptomatic were at baseball games and practices and chose not to disclose that to us. But we were able to, through the work of our contact tracers, find that information out and quarantine and isolate, different individuals and teams. And but I'll let Jill add to that if she has anything else she wants to add.
Well, I think that's true for the most part. I think people have generally been very cooperative. And I have to tell you, I think I've heard the contact tracers on their initial calls, because I'm always asking questions as well. And I think a lot of it has to do with their approach. They are extremely kind. The first question they ask these people are, how are you doing? Not, where were you and who are you with? And I think that encourages a certain level of cooperation and for the public to know that we really have their interest at heart. I really do believe that. I also know that when we get some conflicting information, and this happens at Ludlow High School, we just make another set of phone calls. I mean, just to kind of nail it down a bit better. We did have, in the high school situation, there was a lot of, not a lot, I want to take that back, but there was some unwillingness, let's say, on the part of, as Sam said, a couple of parents, no, not my party, not my house, not my anything. But you drill down on it a little bit better and using, a kind approach, and we really did get to the heart of the matter, I thought, Henry.
Great. That's great.
Can I ask one quick question? Are people who are getting called, do they have the number to call back if they sort of rethink? They have an opportunity to think about what they told the contact tracer and say, well, maybe there are other people, or maybe they sort of decided that they want to be more forthcoming? Do they have the contact people to know where to call and who to get in contact with?
Absolutely. The contact tracers have even gone so far as to give their personal cell phone numbers to these people if they want to call back, if they think it over. Or, we had a woman last week, and she was sick. She was really sick, and I don't think that her thinking was exactly clear at that point. So we, said, okay, get some rest. We'll call you back later in the day. And she ended up calling us. So, it works.
Yep, and we have it set up that, all of the, we have numbers that are available on the website, and all of them, we tell them just leave a voicemail, and all those voicemails are forwarded to the contact tracers' emails, so they get a voice attachment to their emails. So we have that set up so that whatever number they call, we get the information, and even the school system has their own hotline. And that information is coming to us,
Great.
7 days a week.
Oh, yes. 7 days a week.
Christina,
Hi, this is Sally.
Oh. Go ahead,
Can you hear me? It's Sally. It was funny, actually, at the end of the last one, I forgot about this. I ended up not doing anything about it, but I unmuted, and then I was, trying to ask a question, and it didn't work for some reason. It must have been, a central mute. I was like, hello. Anyway, but here I am. So there's a couple questions, and thank you for the info. One question has to do with really what we know about how many people who are testing positive are getting really sick, kind of that's part of it. Kind of a second question is the what's the end game piece of it, and obviously I know we're trying to minimize spread, but just thinking about the balancing with, kind of how the messaging has changed a little bit from the flattening the curve to, it's obviously been this prolonged period of quarantine and behavior change, which again, I understand. I know we're getting into colder weather. There's those challenges. And kind of the third question is with all these, with all the students, is how that's kind of impacting, obviously, not just just other aspects of health, right? Mental health, et cetera. So, those are all, I know those are kind of broad questions, but I'm just wondering how those are being looked at. And I feel like every day, or every other day, we're hearing about another, let's say, suicide somewhere in the area, environment, or connected to somebody, other concerns, right? So I just want to make sure we're kind of just curious about the big picture, I guess, of that. So.
Sure. So I'll start with some of that. So that you asked about acuity. We're not seeing a lot of hospitalized cases right now. So, and we're not seeing a lot of, deaths in nursing homes or cases in nursing homes. We're seeing very small amounts, and the average age of right now, or the median age is 21 right now. So it's really affecting a population that is, in terms of risk of severe outcome, is probably the lowest risk, other than sort of 0 to 9 year olds. This age group is the ones that are getting sick, but they're not really getting needing acute care.
Right.
And then the other question.
And sorry to interject. Okay. I'll let you finish, and then I have one follow-up kind of question about that. But okay.
Sure. So you would ask about the balancing the message. So we are, as I sort of mentioned, this wave will be different in the sense that schools are open, universities are in session, businesses are open, sports are being played. So we are balancing all those things with trying to, in a controlled manner, allow activity with mitigation measures in place. So, but to allow things to reopen, to get businesses going, to allow some normalcy in life, but we're asking people to balance that with the freedoms additional freedoms that we have at this point, is that you need to be especially diligent about where cases are occurring right now. It's really about the message of mask use, and small gatherings are where cases are occurring right now. And so that's really where people need to be diligent. And so we're adjusting the message to that. We're not saying, don't do your sports. We're not saying don't go, to restaurants. We're not saying, all those kinds of messages that we were saying before. So we're trying to balance that because we know there needs to be a balance.
Okay, thank you. That, yeah. Do you want me to go or you to go? Are you there?
I'm here, yep. So did you have additional questions? I know you had there was a list of questions there, and I think I only got 2 of them because I couldn't remember the other ones.
Yeah, who knows if I can even remember. Oh, just the greater mental health implications. And, obviously, like that people in that category, we're seeing some people who are, being affected clearly or, dying from things that aren't coronavirus. But you could, so that's something that I'm concerned about personally, but.
Yeah, and we haven't focused our messaging on that because activity has been relatively low and people have been relatively getting back to some normalcy. So we haven't focused our messaging on that within the past, a few months. But again, as cases start to increase and people will naturally tend to isolate themselves more as we get a little bit colder and as, sports seasons end and things like that. So we will return to that messaging we had done in the past.
Okay. Yeah, because there were a few things. I think now I remember what the question was that came up, or just, I guess it's concern / opinion. But one thing, the last meeting I'd wanted to ask about that I was just, personally a little bit frustrated about was like kind of the blanket cancellations of things. I'm on this, on the meetings always like a promoter of kind of the arts and music and stuff, and that there were all those concerts, that in my opinion seemed successful because certainly to my knowledge, none were linked to some major outbreak. And so then it was like I had gotten a call from Sunrise, and I'm just giving a personal vignette here of one of the issues, of my son's band of high schoolers doing a concert at Owen Fish Park that maybe some people could come from the community and the residents at Sunrise could go out on the porch and watch from afar, so trying to have a compromise. I brought it up to Anthony at Parks and Recs, and he said, well, we're not doing any more concerts. I just want to show you an example of how it's affecting. So that was one opportunity, right, that got squashed that I think could have been creatively figured out, right? Another one would have been that the headmaster at Ward called directly to say, we love the band, we'd love to have the kids do a performance, a video for open house night, and they could even be masked and on the grounds. Then calling into administration, I don't know if, I doubt that came to health department, but that was squashed, right? It was kibosh, like, oh no, this might have some visual of something else. So you see, and I mean, at least the sports kids can do sports. You see what I mean? Like the music kids, some of the theater kids. I mean, because it involves like the musical aspect of things, obviously the singing and instruments, it's a major issue, that performance piece and the performance element, and, those artists and musicians, I mean, they were lucky last night. They got an outdoor wedding, actually, that they played last night at somebody's private home that had just 25 people outside. So it was a great opportunity. But again, I feel like my concern is that we're, instead of this like all or nothing situation, sometimes that there's a little bit more creative problem solving, and I had expressed that earlier when it came to over the summer theater things, right? That my son's private camp was able to make it work at Burr Mansion, but that the public, Parks and Recs one, that there wasn't, and that had been a theater company that's been in existence Fairfield Teen Theater for, 40 years, 50 years, So, I just want to make sure there's just, major attention being paid to that and how it's affecting. I mean, this is not really just about my kid, but I hear it from all of my friends who are immersed in the music, theater, arts communities. So that's the one piece, and then, Yeah,
I think I think we spoke of this, and so I'll keep my reply brief. I think we spoke of this before. The town adopted a general policy to try and set the example of limiting gathering types of events. We didn't preclude them on private property, but we said we didn't want to allow town property to be utilized for creating mass gathering events. We had exceptions to that, which was the concerts on the green that we approved during June, and we watched very closely over the summer. So we allowed some performance events to happen. They were always free to happen on private property, but in general, there was a position of the town that we didn't want to be promoting them on the utilization of town property to promote mass gathering events. And we were asking people to, limit mass gathering events in general, like fairs and festivals and races and, running races and things like that. It wasn't.
Yeah, I'm just wondering the disconnect. Just the disconnect between that, though, and let's say the governor's parameters. Like, there are parameters in place for those events, if followed, So
yes.
That's just a little confusing.
The town made a decision, that which I understand the impact of it. We didn't, those types of events were allowed to happen. They just weren't. We weren't. The planning committee wasn't approving those types of events on public, the public land. And so that was really the only distinction, that we had, the only restriction that we could put in place in terms of trying to limit gathering. We don't have control over private property. There were limits on indoor private venues, but there was allowances on outdoor private venues, and those things did happen throughout the summer. And so, but again, the only thing the town had to do, and it's those efforts, our numbers over the summer were very low, very low numbers, and so whether you attribute it directly to those actions or not, but the fact is, the matter is, we were working hard to drive the numbers down as low as we could, and we implemented measures, and for nearly in the entire summer, right until September, we saw numbers staying level.
So, Sally, thank you for that. I think, to Sally's point, I think what's important is that we continue to have these discussions. That as we've all heard time and time again, this is a dynamic situation, and so it's these sorts of discussions and making it, bringing up these points so that we're all mindful of the ripple effect and the impacts that, I think we want to bring to your attention and to Jill's attention, so that we think about these things the next time it comes up or as circumstances change. So I think, and bringing that up, I think that's a valuable discussion point.
Yeah, I mean, I want to just point out that obviously I respect it. I know when people are making decisions in real time as well, hindsight is always 20/20, right? It's so much easier to say, well, look back at what could have been more liberal, what could have been more conservative. So I totally get that. I just and my last question I'd love to be addressed is, I've seen some videos, and they're not even from the scientists in the States, the one that I watched, so it's not even a political thing, in my opinion, but some of the ones that were pointing to more of this idea of case-demic, where you had such an increase, of course, at the beginning in cases and also in deaths, that were basically synonymous. I'm not thinking of the right word right now, and very consistent with a pandemic, an epidemic, right? And that more of what's been seen lately is the spike in the cases, but relatively flat or very mild increases in deaths. And I know, that's happened to a certain point with the hospitalizations. But I mean, is there any comment on that and kind of how the virus has changed and how it's affecting people in potentially a less severe way than it was in that really hard hitting first wave?
So what I can say is that, what is consistently said on the state and the CDC calls is we've learned a lot since March and April. And so they've learned how better to manage instances in nursing homes. So that's really, especially in Fairfield, that's where the, vast majority of all the deaths occurred was in long-term care facilities, assisted living facilities. And so they've learned how to better manage those through combination of cohorting and testing. And so, it's important to know, what we're seeing now is the start of a second wave. And so nobody knows exactly how this second wave will go. In 1918, the second wave was much worse than the first wave. And so nobody knows exactly how it'll go. Right now, we're seeing a gradual increase in cases. We're seeing a gradual increase in hospitalizations. We're seeing a few more deaths right now. But just like in April, these things were stayed kind of low and all of a sudden spiked up. And so we're hopeful that won't happen. We have tools in the arsenal now that we're doing a lot of things that we wouldn't simply have done back in March and April. And so there's tools available to sort of lessen interaction, to lessen, that can be called upon, but what we're trying to achieve, as you alluded to, is that balance of, if acute healthcare facilities still have capacity, and if there aren't significant deaths in nursing homes, that we continue to allow things to stay open, to allow the economy to recover, to allow all those things that make people feel like they have some normalcy in their lives.
Mm-hmm.
Right.
Yeah, I mean, certainly I know from the connection of doing the home health, and I work with basically every nursing home in the area between here and Greenwich with their social workers and discharge planners. And I mean, I also definitely think that that first wave was that, I hate to say it, but it was all of those people who had been living there for 10 years, many of them, right, 10 years, 15 years in long-term care. Those are the patients that, for the most part anyway, that's what they said. I mean, you obviously have all those numbers, but those are the ones who passed. So it was like, it sounds terrible, but it was almost like that cleaned house, and they've been working to build up, obviously, back their census and people moving in. It's been, a lot of the nursing homes have closed entire floors, because they don't have the population. That's what I'm seeing there. So I think that was a big part of it. You know what I mean? And that it's obviously a slightly different. Maybe that's why there is more resilience or something right now, and in addition to the mitigation. But anyway, just the perspective. But thank you very much.
Yeah, I just think one thing I would say is that we see what's happening in some other states. Here in Connecticut, I think we've done remarkably well. I think we see what's happening out in Wisconsin and other states where it's getting worse. So I think, Sally, the question about the virus itself being less harmful, I don't think that we know that right now. I think that we really have to, at this point, I think we have to be careful because we saw how it increased in exponential form back in March and April, and I think that that's still a possibility. And I understand that people are getting tired, the community is getting tired of these things, and I think what Sam said is totally true. I think we're trying to balance as much as we can, but I'm concerned. I see it at the hospital, and I see it, a little bit more, and I see, I see the workers, everybody's really very good about, you never see anybody without a mask at St. Vincent's Hospital, ever. And I think that's really what has helped our state and our community sort of keep things at a low level. We are seeing an increase, and I think there's reasons for that. But I'm very concerned that at any moment if we're not diligent, we can see the same thing that's happening in some other states now, and I think that we have to guard against that.
Great, thank you. I know, Christine, you had something?
Yeah, I actually just had some questions for Sam. Going back to what you said about the off-campus testing for Fairfield U, on Wednesday, do you have those test results back yet?
So the Wednesday results, we have some of them back. They're starting to show up in the system. I know Wednesday they did. I can pull up the numbers. But I haven't. Wednesday they did, 490 tests. They did 373, and then they did another 490. Of the 373, there were 17 positive. Of the 490, there was 1 positive.
Okay.
So that's what that was from Fairfield U. They, I think they had another batch of testing that was going on that I think they were waiting on getting those results on Friday, but I didn't get an update on that specifically.
Okay, and then just for the contact tracing, and you may not be able to share this just due to privacy, are you seeing that once you make the call telling somebody to quarantine, do you know how many of those people are opting to get tested?
Percent?
Or just a feel for it, Jill. I mean, I know we had a couple of recent positives at Ludlow over the last week or so, and those kids were already in quarantine. But it just seemed like time-wise that it was later than the initial, from when they went into quarantine. And I'm just kind of wondering, are people getting tested or just waiting it out, really?
I would say most are waiting it out. I would also say that when people are speaking with their primary provider, a number of them are saying, don't get tested right away, wait a few days. So that brings it out a little bit longer. And of course, we're all saying, if you're going to get one test, make it a PCR. Don't run to get an antigen, the rapid test, because, we've had so many problems with that.
And I would add to that, that's, to us, that's the ideal. Someone is in quarantine and that's when they become positive. That's what we want to see. Yeah. That's at least tells us the system is working.
Just a question, when you're getting the test results, is somebody else talking?
I think
when
Christine
you're getting the test results, are you able to tell if it's the same person? You know what I'm saying? Like, for example, I got a couple tests at the community health center in Stanford, and they were negative, but so you are able to tell if something is coming back again, so it's not skewing the results?
Yes,
even if they go to different places?
Yes, for the most part, we get results and they're deduplicated up at the state level, and you can see the results, see if it's a person that you already have.
Okay, I was just curious about that.
Christine, did you still have another question?
It's okay.
Okay. All right. And just for clarification, Sands, I wanted to make sure I was right when I was making this comment. So as far as the positive cases that are coming from the university, because there are a lot of folks that are really sort of concerned. I think there was an article in the Poster or recently about there being some concerns from the community. But my understanding is the vast percentage, the majority of university students that are testing positive are still those in the community. They're not the ones on campus. These aren't outbreaks in dormitories as much as they are just in the community.
Well, I'll say it's a mix. So they have the dormitory cases, and that was a significant portion of the cases. They had cases that were amongst teammates on a couple different teams. That was a mix of people who lived on and off campus, and they have the beach area students that were off campus.
Okay. All right.
But since am I muted? No. I remember that they said that you're right. It is a mixed bag because as they described on campus, they shut down one of the dormitories. But then those numbers that you just said about 17 out of 300, that was, as I remember Julia said, those were the beach numbers.
Yeah, that was the focused testing. Yeah,
right.
In the beach area. The previous day they did 518 surveillance tests, random surveillance tests, and they had 2 positives. So that's, both on and off campus students directed to report for random surveillance testing. And out of that 500 plus, they had 2 cases.
All right. Great. Thank you, Sans. Are there any other questions about tracing or the university? Otherwise, I interrupted, Sans. You can continue with your...
Sure. I'm about a quarter of the way through, so I'll just continue. I'm just kidding.
Oh, come on.
So I just wanted to share about mass vaccination planning. So the state has had for the last, I think, 3 weeks for mass vaccination planning conference calls just to start the ball rolling in terms of the expectations of the state. Jill and her team are working on the provider agreements that we have to submit to the state. It's basically through the childhood vaccine program. We're already enrolled in that, already participate. So that is the system they're using. It's just an additional provider agreement that we're working on completing. And that will enable us to order through the state the vaccine. We've already submitted to the state our critical workforce numbers. So it's essentially those numbers that CDC deems are the critical workforce, and that those people will be in phase 1A of the vaccine distribution. And so those individuals will be the responsibility of local health, that particular phase. And so we will be responsible for vaccinating police, fire. We'll be responsible for the municipal based. They'll be doing healthcare providers, and that'll be based from the healthcare system agencies. But so we're working on the plans there, and so that is moving forward. And then we already talked about the new video, and then I did want to just talk about, which made caused some concern, is the state on last Thursday issued this new town level alert system. And so essentially the state changed some of the metrics that they haven't used before to create this new system. And so lots of other states were using this, had developed this sort of town level alerts. You categorize the towns into 3 different categories. And at each different level, you have different recommendations. And so the state of Connecticut came up with their own. They ran the numbers, which is a daily average of new cases per 100,000 over a 14-day period. And so as it happens, they kind of caught us on the second week of the Ludlow situation and the first week of the Fairfield Hughes situation. So it put us up into what's called the orange level, which is the middle level of the alerts, yellow, orange, and red, which caused some concern because there's a system for the school metrics, which also has a yellow, orange, and red categories, and has different, at least up until this point, had different metrics, which was, the same metric except over a 7-day period. And so the state has decided to change the school metrics to a 14-day period to be consistent with this particular town level alert. But it's somewhat confusing in the sense that you've got these 2, 3 category systems that have some slight differences, but seem the same. And so there was some concern about that the school system had gone into the orange level on the school metric system, which we had not. But there's some parallels here, and the recommendations at the orange level are recommendations that we're somewhat already doing in the town, and so it wasn't any significant change for the town. Really, once you get up to the red level, it has some significant changes, but it also still has the same metrics of consider going full remote learning if your number is above 25 average daily new cases per 14 days, and so which was previously was 25 average daily new cases per 7 days. And so it still has the same numbers. The state has said they are going to be adjusting. That's from Addendum 4, those school metrics of the school plan, state school plan. The state said they'll be adjusting Addendum 4. What we hope is that, well, what we're not entirely certain on, and the state has kind of said we think things will stay the same, but they've kind of said we've learned a lot since that system was developed, and we may make some adjustments to it. And so that's, but the state will announce that when they announce it. It hasn't come out. But right now, the school metrics for now are the same, and the indicators, leading and secondary indicators are the same. But we have this new town level system, which, I don't know if we'll drop out of the orange category next week when it comes out, or this week when it comes out this Thursday. We'll see. We expect it to go down a little because the Fairfield cases have gone down somewhat. But we'll see. It's also, we have this, additional testing that went on at Fairfield U. So it did yield some additional cases. And so we're kind of, we'll wait and see how that goes in terms of what this week's level will be. So with that, I will end my remarks.
Thank you. Any other questions in regards to the vaccine or anything else that Sam's brought up? All right, fantastic. Jill, you're up.
Okay, I just thought I'd give everyone kind of an overview of where we are in numbers at both the public schools and the private schools. As of today, in the public school system, we have 5 positive cases, currently positive, 3 students and 2 staff. We also have 55 students or staff who are quarantining right now. Now, as Sam's mentioned, through our contact tracing, none of these cases could be linked for any exposure within the school. We did have a number of the Ludlow High students who were on quarantine, who, while they were on quarantine, tested positive, and that's the way we like it, while they were on quarantine. All of the schools, except for ECC Ward, Burr, and McKinley, have been affected, though, at this point. So it really is fairly widespread, but going back to what Sans was describing as a lot of household exposures, mom and dad going out to work and they're positive, so the children have to quarantine, or, the small gatherings. The parties that we heard about from the high school recently, they were small gatherings. They weren't, the huge blowouts in someone's backyard. In the private school sector, a little bit different. 76 students are in quarantine with 13 positive cases. Most of those cases are at prep. But again, it's, dad down in Stamford and his son is now positive, and the couple of guys he had over to watch the game last weekend, they're in quarantine and hopefully testing. Every school except every school in the private sector is affected except for Notre Dame. So let me see. I just want to say that the school nurses have really expanded their role in terms of contact tracing, in getting working with the teachers and the principals or the head over at Ludlow High, for example, and just trying to really define where the child was, what were the exposures in the school setting, and how we can go from there. The school or teacher, for that matter. And it's been, I have to say, I think the contact tracers are really just doing a marvelous job. I'm really impressed with what they're doing and the unbelievable efficiency with which they're doing it. I mean, 5 hours to contact all these people in one day is really remarkable. So we were at the school, I think Henry and, of course, Christine were at the school reopening committee meeting today. And a lot of questions were asked about, the logistics of it all. Certainly social distancing with students in their full 100% in-person is going to be a consideration. And those were most of the questions that I had either today or offline that they were asking me about before. They are planning to go ahead with reopening the schools. I'm sure you all know. It'll be the week of November 9th with K through 2 starting off on Monday, and then 3 and 5 starting on the 12th, which I believe would be Thursday. So they're going to do that. Plans for opening the middle school are just starting. I think people are just initially talking about it, and well, we look forward to that. I mean, there's a lot of configurations. People have to address busing and outdoor recess, and where do you eat your snack and your lunch, and the 3-layer partitions, and do the children carry them around with them from classroom to classroom, which they probably won't in an elementary school setting, given the nature of the classroom structure. But in the older grades, that might be a possibility. So all these logistics, and there are many of them, need to be ironed out. On our end, I met with all of the nurses last week in elementary grades, a secondary meeting, and then a private school meeting, just working on, and I've spoken to Henry about this earlier in the year, about the school health office protocols, and what we can do to make them a little bit more reflective of what's actually happening. We have not come to any decisions about it yet. We did get some very basic guidelines from the state earlier in the year in terms of what kind of symptoms, the 5 major symptoms that we need to take immediate action on, which means, into the isolation room, which we have used. We have, the nurses have gowned up and put the students in isolation rooms, and thankfully, none of those students have tested positive, but reviewing cleaning protocols with the custodial staff and teaching them about donning and doffing. I mean, a lot of that health office management, it's a lot, but we want to make it better. And we've been in school now for about 6 weeks, and I think we have some, I can't say data, but we have some anecdotal evidence as to what we can do to make our assessments better and just serve the population a little bit better. Let me see. Contact tracing. On other notes, Staffing is always an issue with public health nursing, and I've asked HR for a couple of positions, everything from a nurse coordinator in my office to the health aide, and I haven't heard back yet, but I pursue it every week, trying to get. I have people applying for the jobs, and I don't even have the postings yet, so we're working on that. And the other thing I wanted to talk about was flu clinic. We did not ever schedule one huge clinic this year because of the concerns about transmission and elderly people and in the senior center. So we had a number of smaller clinics serving up to about 125 a day. We had them in the evening, we had them in the morning, late afternoon, and we managed to, just this afternoon, we finished up, and Brenda Kupchik actually came. She was one of the last ones we had today. We did about 900 flu vaccines. And we're just about done. We're run out of the flu vaccine that we have had delivered. We are expecting at least as much as that to be delivered, but we've gotten some notifications that they're put back about 2 to 3 weeks. So we were planning to do a big drive-through clinic, and we still may do that, but of course we don't want to be planning anything when we have no vaccine in the fridge, so that will have to wait. And I think, really, that's about it.
Great. Thank you, Jill. I just had a question about, or just a comment to share with everyone. I think, with the rapid testing or the antigen testing that's becoming more and more prevalent in the community, I know that my understanding is that SDE and DPH are going to be putting out some guidance in terms of how to interpret some of the antigen testing.
That's right. We had a call last Friday. Were you on that call, Henry?
For part of it, yeah.
Yeah. I didn't get any feeling that they were, certainly nothing specific in that phone call, but yes, I believe that they were going to be redoing the, I guess was it from Addendum 4 that they were going to be revising, in which they would address the antigen testing in that? I think that was it.
It was 5, Addendum 5. Yeah.
And that's what the nurses are going to have to go by, right? Or it helps provide them some guidance as to what to do with students that are sick or getting antigen testing.
But I'll explain that, Henry. I mean, yes, it is fairly clear in Addendum 5. But in Addendum 5, you have, if you have the symptoms consistent with COVID, but then they refer you to, the footnote on page 11 where the CDC has, the laundry list of all the other minor symptoms. And, as well as I do, childhood illness mimics a number of those symptoms, everything from the fall allergies that we saw to, just a cold, just the sniffles, as a parent quaintly put it to me the other day. And right now we're asking for a lot. We're asking for all those children, to be taken to the doctor, have the doctor assess the child, provide an alternate diagnosis. And it's a burden on the parents. It's a burden certainly on the providers. And I'm just trying and you have to balance that, of course, with the risk that we have a child who may potentially be infectious. And it's a difficult situation.
Right. Great. The other question I had for Sands, or comment, and I fully acknowledge that this is a loaded question, but I'm going to give it to you anyway. So, and it has to do with, there's a lot of discussion in terms of schools with going from 6-foot distance to 3-foot distance, and I think we've all acknowledged the fact that the AAP, the American Academy of Pediatrics, has earlier on had made some comments that 3-foot distances in certain circumstances could be maybe acceptable, but I think DPH has stressed the fact that should schools move in that direction, that it really needs to be in addition to other mitigating strategies, such masks, hand washing, barriers, things like that, as well. But my understanding is that our Department of Health has not taken the stand that it is okay to do that in and of itself, to go from 6 feet to 3 feet. Is that correct?
You mean the Fairfield Health Department?
Yes.
Yeah. So essentially, the state has said, that their guidance all along has said, 6 feet whenever possible. The CDC guidance that's out there says maintain 6 feet of distance, and when you can't, wear a mask. So inherent in that is the assertion that, closer distances are acceptable as long as you have other mitigating factors built into them. And so, the lesser distance has to be accompanied by additional mitigating factors. And so that's what we've kind of agreed with, what the state's position is that, maintain 6 feet if you can. If you can't, you've got to do things like, have really good mask policy, have, design the class with as much distance as possible between the desks, so that, potentially if you have the desks arranged a certain way that potentially we won't have to quarantine the 8 desks around an individual desk. Maybe you just have to do, 4 of those, the ones that are closest, if you can arrange it in certain patterns. So we've had discussions about that. We shared that. We've shared positions from the State Department of Public Health that says essentially that, and even the article you referenced says, a minimum of 3 feet, 6 feet is ideal. So it's I think everybody acknowledges that. It's just that it also acknowledges that in most instances, it is just simply not possible to maintain 6 feet with full enrollment in a classroom at any level. and so there has to be other mitigating factors such as mask use, ventilation, and those types of things. And, so Fairfield is doing those additional mitigating factors.
All right. Great. Thank you. Does anyone else have any questions for Jill or Sands? Great. Any communications?
I have none.
Neither do I. Any old business?
We have none.
No. Any new business? Anyone?
Not tonight.
Great. Fantastic. All right. Well, thank you, everyone. Can I get a motion to adjourn? Thank you. All in favor? Aye.
Aye.
Thank you. Sands, the only other question I had for you, since the meeting is officially adjourned, your reference to the Spanish flu in 1918 and the fact that the second wave was more impactful. Is that from personal experience? Did you witness that?
That's from that book. There's a book out, The Spanish Flu, and they go into detail